I was working as a clinical social worker at University of Florida Health. I was the social worker for several primary care and specialty clinics, and one of the specialty clinic was the pediatric diabetes clinic. So I really became very familiar with diabetes in that setting, with type 1 diabetes in that setting. While I was working there, and I had a soft spot for that clinic and those patients and a lot of providers that I was really close to. And I discovered while I was there that my own daughter, who was 12 at the time, we had some labs that were a little bit off. And knowing what I knew, I went to our diabetes educator and said, "So what what does this mean? I'm a little worried about this blood sugar." It wasn't anything, too outrageous. Um, Long story short, I wound up getting my daughter in with one of our endos within the next week. She was like, just, bring her into clinic and, we'll just check her out. And she was tested for autoantibodies, and we discovered that she actually has a couple of autoantibodies, one that's a particularly high risk antibody. And so that was it'll be 3 years in December that we discovered that. And so then, my experience went from this professional and really seeing from this professional lens, like the burden, to thinking about, oh man, this is where I live now. I was struck. I was very shaken at first, knowing what I know as a social worker and having seen some really difficult situations that families were dealing um, with T1D. And I think also the piece of just not knowing when, knowing that it's coming or almost certainly coming, but not knowing if it's going to be, we were given a certain percentage, like 75% likelihood of onset within 5 years. And I think even since then, we've gotten more information, like in general, that like the diabetes community has gotten more information about onset and what happens. And, just watching my daughter's journey as she's kind of bounced back and forth between stage 2 and stage 1, knock on wood, she's been pretty stable for the last year or so, which has, been a relief. But I think that was a real turning point for me where I was like, this is, there is such a need here. And I really just I really want to serve this population. And I think, I think I also have the thought that, I love kind of the mission of Blue Circle Health, right? Is that we're taking the whole person, and doing something very differently than the healthcare system does, because people with T1D deserve that. They need that and deserve that. And, I've always had this thought, like, this is what I want for my child, right? And so I want to show up in a way for others that I would want my child to be treated. Every person who comes to Blue Circle Health, right when they enroll, they receive the Diabetes Distress Assessment Scale, or the DDAS, and that gives a really great snapshot, not of just the parts of diabetes that can feel really hard, just for some context, like that, those measures include, like, if there are worries about complications, it'll give a number for how high their distress is around that, or if it's around financial barriers to being able to access what they need, or feeling like a burden to others. Sometimes I'll talk to people who have never even been asked these questions, right? And just haven't had the acknowledgement that these are really real and understandable feelings and experiences that a lot of people with T1D experience, right? It's a diabetes distress is a really, like, understandable, normal response to living with T1D. And so I think starting with just acknowledging, I see, when I first talk to someone, like, I see that, when I look at the way that you responded, I see that feeling like a burden to others is something that comes up a lot, based on how you answer. Can you tell me about that? Like, what does that look like for you? And really just allowing them to tell their story, right? Because I'm not the expert in that person's life or their story. They're the expert in their own life and their own story, right? And so really, I think just providing a safe, non-judgmental space and asking them to share their story. It starts with, providing the space, acknowledging where they are, meeting them where they are, and and asking them to share their story as much or as they're comfortable. I always assure people, like, this is for you. It's voluntary. If you're not comfortable, it's okay. Like, I'm here if you need me. And I'll also often acknowledge that, often, I would say almost everyone I've ever spoken with who lives with T1D, at some point in their journey, maybe at many points in their journey, they have felt judged or criticized or shamed or scolded. And so I will often, like, just bring some acknowledgement to that, and say, I know that often this is what comes up. Maybe intentions are wonderful, but there's been some harsh messaging, and I like that. That's not gonna happen here. And absolutely, as if you are comfortable and willing, like, I am happy for us to have these conversations. I would love to be able to provide that space. And if you're not there yet, that is absolutely okay too. I am just so glad that you are here at Blue Circle Health. And yeah, I just want you to have what you need. Because I think that too, right? It's just acknowledging that they have a choice. Sometimes it's just a matter of shifting that lens just a little bit, and changing perspective to help someone see, like, how much potential, how much power, how much power they have over their own lives and their own well-being. And it I think too starts with reminding them of, okay, let's look at these things that you're doing right, of all of these incredible strengths that they do have, and how they've demonstrated those strengths time and time and time again, and really uncovering kind of all of those strengths, and then shining a light on that, things that they really get right. Which speaks to their grit. And sometimes just being able to see that and acknowledge helps kind of with that shift, that lens. Like, oh, I do that well. I do get that right. I can do this. I hope they feel empowered. I hope they feel like they've been seen, that they've been heard. Like, I want them to leave feeling like they have a different relationship with their diabetes in some way, whether it's they feel like they've achieved goals that they've set for themselves with time in range or A1C, or whether they feel like, hey, I know how to have an empowered conversation with my healthcare provider now, or, oh, I really understand how to use a CGM now, and feel really comfortable with this technology now, whereas, previously they hadn't felt comfortable. Like, I want them to feel empowered. I want them to feel like, yeah, it's hard, but I got this. Like, I got it.